We began Trillium as a platform that was going to be developing and identifying biomarkers, bacteria in the microbiome. Better understanding how the microbiome ties into disease processes, and in hopes of saying we as physicians understand, disease processes. What we don't know is what is in the microbiome that might predict disease in the future, might predict new therapies in the future. And while that's been looked at here for years, it has come out of the technology community. The online, microbiome kits or stool collection kits. And it's not really rooted in science. It's rooted, it comes from a place of seeking data. And data is obviously very powerful. We realize that, a little bit later than the technology industry did. Healthcare is now understanding that data is important. But what we do with the data really should be, in partnership with the scientists that understand the disease process. So, for example, a patient may come in with a stool test and there's, 200 different organisms, bacteria, listed on there, and they don't know what to do with that. It's more confusing for the patients. And to be honest with you, we as providers don't know what to do with that either. So Trillium was there initially to say, let's take a really serious look at the microbiome. Let's look at other biomarkers, say in blood and other tissues, and let's see if we can begin to, instead of treating disease, predicting people who are at risk on their microbiome. Understanding also where people who say, I feel normal, I don't have any issues that are interfering with my quality of life. What does that microbiome look like? And is there a way for us to take the microbiome that we know from the patients that we see and then say, well, we know that if we can get you to where the normal population is, then that's a probiotic or that's a bacteria or that's an organism that we need to focus on. Because right now it's hit or miss.